So again, let us know if you have any questions on that. Okay, now we're going to go into the didactic. So I'm very happy to have the Northern Light East Main Medical Center faculty team is going to be presenting the didactic today, and they are going to be talking to us about lung cancer screening reporting results. So I'm going to turn over to them to just introduce themselves and tell us what they do, and then they'll roll into the didactic. So I'm going to turn it over to you folks. Thank you so much.
Hi. Okay, I'm Kathleen Bernard. I'm the nurse practitioner with the lung screening program and the thoracic program. So we're talking about lung cancer screening reporting results. And this applies to how the scan itself has is read and what we do with it. So next slide. Oh my God, that's small. Okay, so this is what we use. The radiology department uses Lung Rads version 1.1. So that is an updated read. It's a little more in-depth than what was originally in place. It's the radiologists follow this when they read all low-dose CTs, and they do use this when it's on seat follow-up CTs that are related to lung screening. So those 6-month follow-ups or 3-month follow-ups. Okay, so all of these recommendations are printed on the actual report. All right, next slide. Go fast. So RAD 1s and 2s. So those are considered benign or negative scans. So RAD 1s, there's no nodules, and there's definitely a benign nodule. So those would be very small. And then the 2s would be a benign appearance or behavior. So it does list out, if it's periphyseal nodule, less than 1 centimeter, a solid nodule less than 6, or a new, on a repeat CT, a new nodule that's less than 4, and it goes into detail. So, based on size and whether it's solid or ground glass, it's recommended of low-dose CT in 12 months. And the vast majority of the scans are going to fall into this these two categories. Now, as far as our follow-up, we have a review date 30 days after the date of the low-dose CT is due. So a year from the first one, we know it's due. 30 days after that due date, a letter is sent out. We check. We check online, we check for orders, we check for impacts. So we look in the chart, we look around to see if there's anything that's been done or an order is sitting there waiting. If we don't see anything, then a letter is sent to the PCP or the ordering provider and the patient reminding them that this was due. If we don't hear or see anything within another 30 days, so at a 60-day mark, then we send another set of letters. And 30 days after that, so at the 90-day mark, if there's still nothing there, then a final letter is sent, and it basically says that if nothing is there in the next 60 days, then we will drop the patient from the program. And both the patient and the ordering provider are notified of that. So essentially, it's like 5 months out from the original date of the scan.
And I will say with that 90-day letter, that's typically when we see the order placed or the patient calls saying they do want the scan. So we do get a lot of calls and feedback generated from that 90-day recall.
Next slide. RAD 3s. So these are probably benign. A solid nodule from 6 to 8 millimeters at baseline, or anything that's new, greater than 4, less than 6 millimeters. And then again, it goes into the part solid, and then non-solid nodules, so the ground glass. So these are probably benign. They need some type of short-term follow-up. and those with like a low likelihood of being cancer. So that's the recommendation of 6-month low dose CT. About 5% of the population of the scans done would fall in this category. And these are handled the same way, the 30-day, 60-day, 90-day reminder letters. And so we follow it the same way in the same documentation. Okay, next slide. How fast I can go. All right, RAD4s. Okay, so RAD4s are broken into 4A, 4B, 4X. So these are suspicious nodules. Solid nodule that's greater than or equal to 8, but less than 1.5 centimeters at baseline, or growing less than 8 mil. Anyway, it's too technical. It's 4A. Read the chart. So this would be, the recommendation from that would be a 3-month low dose CT. A PET CT may be used when there is a greater than 8 millimeter nodule. It's not sensitive under that. There's a solid component. So, again, 4A, that's 4A. 4B is solid nodules, part solid. Again, a CT with or without contrast. So there are a number of options for the radiologists to make recommendations in these categories. And we see really a variety. Some will say PET, refer to pulmonary. But one of the things we've added is the TOC, Thoracic Oncology Conference. So all of these RAD4s, recommendation is presented TOC. So the TOC is held weekly here. We do have an opportunity for ordering providers to call in and participate and present their own case. We tend to bring our catchment ourselves, and we bring St. Joe's to TOC. And that has radiation oncology, medical oncology, thoracic, pulmonary, and radiology present. And it's a general presentation of each case. It's not a super in-depth presentation on each patient because we don't really know as much. And then recommendations are made. From those recommendations, letters or phone calls, documentation is sent to the ordering provider, giving them the recommendation of TOC. And then we set reminders based on those recommendations. So if they say refer to pulmonary, we're following up to see if that happened. Did I miss anything on that page?
It is the responsibility of the ordering provider
Yes.
to order any of the TOC recommendations. We send them a letter and it has the recommendations, and we sent reminders out for a couple of weeks to see what the status is.
Okay, next slide. So this is what a typical RAD4 report looks like under the impression. So they reference multidisciplinary thoracic conference review. And we have it worded this way because Mercy doesn't fall into our catchment. So anyone else who does fall into it can call our program. But we're also, they're checking every day for RAD4s. We're watching our own, patients, but we're also checking impacts for RAD4 reads. And if they apply to us, how do you do that? Yeah. If they apply for us, and if they're part of our group, then we just pull those off and start working on bringing them to TOC.
Yep, and we also notify the ordering provider of the scan
Yes.
that we will present at TOC, the date of TOC, and when they can expect the recommendations. The other thing we do as well is, especially this example of the RAD4, it talks about ordering a PET CT or a CT guided biopsy. We also encourage the ordering provider to get moving on those, because oftentimes we've seen patients that have had a scan on Thursday. By the following Thursday, we have both a scan and the PET scan to present to the team. So I always encourage folks to get started on that, because sometimes with insurance, it can take a little bit too. And I don't want them just waiting for the team's recommendations.
Okay, next slide. And there's TOC. So that's some of the people, most of them. That's it. And the end.
Thank you so much. That's awesome. This is wonderful information, and I'm sure super helpful to everyone. So we're going to open it up to see if anyone has any specific questions for the didactic, and then we'll move on to the case presentation, which is also very much related to this. So we're going to continue this conversation together. So remember, this is just questions. We're going to have